Hello all. Today we will be discussing the diagnosis on the scoliosis diagnosis in a little bit of details or basics, actually the basics, not lots of details, but the basic for diagnosis of this particular disorders. Diagnosis for scoliosis includes history, of course, as we all know our role in the medical field, the clinical exam, the neurological tests. We add postural tests. Some institute at some clinic focusing on genetic variation or gene variable tests, hormone neurotransmitter chemical tests, even osteoporosis tests on both like maybe urine analysis or DIXA scan. And of course, we have the golden standard for the X-ray assessment for diagnosis. Then we have certain type of scoliosis that we are required, like if it's congenital, we require CT for the detecting bone deformity or MRI in case of soft tissue deformity. Then the last thing will be the respiratory evaluation tests that we could obtain in our clinic. In the history part, we go with the basics, the height and weight. That's very important and critical for two reasons: to follow up our regime protocol for treatment, and to determine the next visits. Which visits, like some visits go by months, like 6 months, 3 months, 12 months in certain cases. And some visits go by the growing diameter, like parameters, like if he gets taller 5 to 6 centimeters, we need to see him. Once he reaches this landmark, we don't have to wait for the 6 to 12 months, and so on. So weight and height, it's very simple, but it's very critical. Same thing as age. We need to know the age to determine our gross pattern, along with lots of stuff that we know about how to evaluate the gross pattern. Important things too is delivery history. How this patient was delivered, on his birth history, how he was delivered normally, cesarean, was bold, vacuuming, clap, what kind of delivery he obtained. And of course, we look for the puberty sign, both external puberty, secondary characters, and of course history. And in female, we look about the menarche, we ask about it, because this will determine what stage we are as far as gross development on our case. Family history is important, so we can see if there's a red flag, like most of the family, her sister, her brother, her mother has a scoliosis. This will give us a red flag, like this is something going on in this family, so we need to pay more attention and move more faster towards our patient, toward the diagnosis and the treatment. And last thing in history, which is very, very important, if you, for example, not all the patient will come to you as new scoliosis patient. Some patient will come to you as scoliosis patient diagnosed like a year or two earlier. They did some stuff and didn't work, so they come in to see your advice or consultation. It's very important in details to know the intervention that they have before. Some patients even come to you after surgery for evaluation. You still need to know all the kind of intervention. Did they have a surgery? Are they planned to go for a surgery? Did they have braces? Did they have exercise? In details, frequency, repetition, type of exercise, belongs to which school of scoliosis exercise, compliances, and all this detail about any intervention that happened before. It also gives you a good information about the compliance for this patient. You know, after time and when you obtain some experience, you can tell, okay, if I order this brace for this patient, he will be compliant and he will wear it and everybody will be happy. The second step is a clinical examination. As we mentioned before, the Adams is a very basic standard clinical exam. Then we have the scoliometer, skin inspection, looking for all this different deformities or different signs that in certain and particular sclerotic patient, and it reveals itself on the skin of the patient. Joint hypermobility, laxity for joint hypermobility to exclude certain syndromes. Then we're still in the non-invasive part here. We use our surface topography, trace scale. You know, all of you know by now the 0 to 12 scale, and anterior trunk rotation, anterior trunk symmetry index, posterior trunk symmetry index, as we discussed in the earlier episodes, give us an idea about how the aesthetics is looking for this particular patient. The hum measurement, we obtain the hum measurement and we palpate the hum and see if it is reducible or not, or by certain movement does it go bigger, smaller, is it reducible? That's very important for the along with the lateral flexion for stiffness versus flexibility for the curve. So we have the history, we have the clinical examination, and we can now jump on the same. We're still in clinical examination, but we go a little bit specific. I will start with the gene variant test or genetic variation test and hormonal neurotransmitter testing and DEXA scan. I'm going to put these three together because lots of or some of the clinic here in USA, they adapt the theory that, yeah, all this scoliosis, idiopathic scoliosis changes are due to and result from gene variant and hormonal dysfunction, neurotransmitter disbalance, and osteopenia, osteoporosis, certain vitamins deficiencies and stuff. And they focus on this, and they have even a kits that they use for this particular testing, which is okay. I'm okay with that, you know, but I put a lot of weight on other stuff, and gene variant and hormonal neurotransmitter and DEXA scan is okay to know and to obtain from the patient, but it's not the major things. The major things is more serious and more critical. I'm not against this, but for me, it comes, as you see here, as number 10 on the list of the diagnosis and the testing. And of course, we have the X-ray, which all agreed on, CT, 3D, MRI. We have also respiratory tests in certain hum measurements, the hum measurement or the hemothorax measurement. We have to evaluate, or some red flags like left curvature and stuff. We have to evaluate respiratory function along with cardiac function. That's a different thing, different episode, but I have to put it here because it's the main thing. Then we go to the neurological test to found any upper motor neuron lesion, lower motor neuron lesion, strength of the muscle, sensibility, somatomotor, deep tender reflexes, abdominal reflexes, especially the superficial abdominal reflexes. Try to do small, like fast Papinetsky sign, vestibular dysfunction by using the postural rhombering and Fukuda's, semicircular canal, nystagmus evaluation. All this very small, non-invasive stuff that you can obtain it in the clinic will give you the big picture about the case that you're dealing with. So we have the history, then we got the clinical exam, then we go to the gene, some specific testing, chemical testing, Then we have the neurological tests, which can obtain in the clinic as simple. Again, this channel is for scoliosis healthcare providers, and it fills the gap among different scoliosis clinicians through scientific literature and research paper, and it's very important for patient and family. My name is Dr. Wael Abdullah, and I'm a medical doctor and a chiropractic doctor, and we'll see you in the next episode. Thank you, and you have a great day.